I'm here tonight, with the other Dr. Hanlon in my life, Dr. Courtney Hanlon, who's a physician at LA County. I know I've mentioned that to you before. And she is here to help sort of talk us through some of the blood tests and other lab tests, urine tests, that we see performed on patients to collect information about how their bodies are functioning. So we're going to start with the CBC, and then we'll just have a series of little conversations where she's going to sort of talk us through, and then we can learn more about why these tests are done and what a physician might look for on these tests and what the results might mean in terms of treatment. So I'm going to turn it over to you. Thank you for being here, Courtney, Dr. Hanlon.
Hey, thank you very much. It's a pleasure to be here, and thank you all of you for taking this class. I'm delighted to be here. And so I'm going to be going through some of these lab tests, kind of just at a 10,000 foot level, try to get a feel for what some of these can mean. I'm not going to go through every single thing, but my hope is that we all learn a little bit more about, what kind of some of these common lab tests are, what they mean, and then yeah, just get a general feel for some of the more common blood tests and urine tests that we do in both the hospital and in the doctor's office. So I'm gonna, talk a little bit about these tests. If you have any further questions, feel free to reach out to Dr. Hanlon. You can get my contact information from her, and I'm happy to help with any questions. So right now, what we're looking at, you can see in the top left of the diagram, it says CBC. And this is a very common test that we get. It's called a complete blood count. It's a blood sample that we take. So when we draw your blood, we're probably getting one of these tests. And it's to look at a few common things. What we're seeing here is really the different cell types that are in your blood. So we're looking for things like anemia or things for infection. The first lab value here is white blood count. Most commonly, when you think of white blood cells, you think of the immune system. So if these cells are high, or if your body's making more of them, it can be a sign of infection, and it often is. But there are some other things that can cause increased white blood cell count as well, like steroid use, if someone's on prednisone for a long time, or certain other diseases. So if you see that someone's white blood cell count is high, if they have signs of infection, maybe it does mean infection, but it could mean other things. So just, keep that in mind, and it's really more in the context of like everything else that's going on. So it's a helpful thing, but doesn't necessarily mean infection. And if it's low, it could also indicate, something maybe going on inside someone's bone marrow, or their immune system's not responding properly to something. The other labs on here, there are a lot of different labs. Really, the main one that I want to focus on besides white blood cell count is the hemoglobin. That's the molecule and sort of the molecule within the red blood cells that carries oxygen to our body. Most commonly, when someone's hemoglobin is low, we call that anemia, which is, a common thing that patients have. So, and you can check the ranges online. They're different for men and women. It says here the reference interval is 14 to 18. It's a little bit lower for women. But you can see on this sort of example panel, the hemoglobin is 10.8, and there's a little L next to it, and that usually stands for low. This is just an example lab test, but typically if there's an L next to it, it could mean low, or if there's an H next to it, it usually means high. So this patient's hemoglobin is 10.8, which is low. It's outside of this 14 to 18 range. And there are a number of things that can cause that. But again, we would call that anemia. And it's something to note, and it's something that the doctor will then try to figure out what's going on, kind of using these other lab tests below it. We don't really need to go into detail of these, because all of these things like polys, that stands for polycytes and lymphocytes and monocytes, these are all actually different types of white blood cells, different types of cells in your immune system. So all these lab values, basically from the polys, the lymphs, the monocytes, and down below, those all help the provider to get a better understanding of what might be causing any abnormal lab values, but it's not something that we typically need to know right off the bat. So I'm going to try to not go into too much detail about those. I think that's out of the scope of this particular class. But again, main things: white blood cell count. If it's high, could be infection, could be something else. If it's low, maybe the immune system's not doing what it should. And then the hemoglobin, when that's low, we call that anemia.
Is there a relationship between the hemoglobin and the hematocrit values?
Yes, there is. Um, and sort of a rough estimate sometimes is that the hematocrit is typically around 3 times as high as the hemoglobin. They are, I would describe them as similar measures of essentially the red blood cell count, which is that red blood count that's above it. Um, and they drop at different rates if someone's red blood cell count is going down. So the hematocrit, drops at a different rate than the hemoglobin. Again, in the context of like a doctor's office, we usually just use the hemoglobin to sort of classify someone's anemia. But the hematocrit can be helpful as well in the hospital setting.
Thank you.